Well, we are coming to a better point of understanding of what causes many types of gynecologic cancers. For uterine cancer, one of the strongest risk factors is actually being overweight. So a woman who's more than 50 pounds overweight can increase her risk of uterine cancer by up to 10-fold. And that's about 3 times higher than just taking unopposed estrogens if you have a uterus. For other women, there may be a risk factor of some types of hereditary genetic problems, the most common one being something called hereditary non-polyposis cancer syndrome, or Lynch 2. These women have a high chance of having endometrial cancer, which may be up to 80%, along with colon cancer and some types of ovarian cancer. Ovarian cancer is usually caused by a lifetime of a lot of ovulatory cycles. So the more ovulations a woman has in her lifetime, the more likely it is to develop ovarian cancer. Now, the things that increase ovulations are fewer children, a longer time of menses, in other words, early onset of menarche at an early age, or late menopause, the absence of the use of birth control pills, the absence of breastfeeding, those things contribute to that. There's a small set of women, about 1 in 10, that have some sort of hereditary gene that puts them at higher risk of developing ovarian cancer, and that risk can range anywhere between 20 to 40% depending on the exact genetic risk. This is typically known as BRCA, hereditary type cancers. For other cancers like cervical cancer, we know that most of these are related to a virus called human papillomavirus. And there are many different types of this virus, but some of them can be more apt to cause dysplastic changes, which are precancerous growth, and actual invasive cancers. So typically this is dealt with by screening for this and trying to prevent cancers from developing in women.